So this first exercise is a lumbar roll. So you're going to flex your neck, flex your rib cage, reach your hands down, and then push through the feet and extend your back. So what we're going to do, we're going to neck is leading the movement. We're going to try and get as much of a curve into our lumbar spine as possible, touch the ground, and then coming back up, we're going to push through our feet and extend through our lower spine. So again, relaxing that neck, relaxing through the back, and working into extension. So from the side, the neck is leading the movement. We're getting that rib cage depression, reaching those hands down, and then coming back up, you're almost going to have a ragdoll like kind of movement as you move into extension, feeling the weight. So on the way down, you're depressing the rib cage, feel the weight on the heels, and then really feel that weight shift onto your ball of your foot as you move into lumbar extension. The next exercise you're going to set up is a hip flexor stretch. So you're going to avoid an anterior tilt, get yourself into a posterior tilt, and then you're going to feel a stretch in your hip flexor, lean into that position and come out of it. So you want to get into posterior tilt and then bring your body weight forward, keeping that posterior tilt throughout the movement. And then imagine a rope is pulling your belly button up towards your sternum to feel that posterior tilt. Holding that in range for 3 to 5 seconds each time. Again, the posterior tilt is going to help to feel this stretch a little bit more in your hip. So the next exercise here is just a hip rotation. So what you want to do is keep your hip against the wall. You may have to find neutral spine. Then you're going to abduct your hip and then extend that hip, trying to limit any movement at all in your low back. You're going to have some movement here and then into flexion, but you want to avoid it as much as possible. So begin 4-point kneeling, abduct that hip to the side, and then from abduction you're working into extension, holding that in range, into flexion, and trying to just get as big a movement and a bigger rotation as possible through your hip each time, moving slowly and with control throughout. So again, we want to avoid any movement in our low back if we can. The next exercise we're looking is just an active hip stretch, really targeting the hip abductors. So you're going to set up in a 90-90 position. You want to place a towel or a yoga block under your knee that's forward. That's really important here. See if you're comfortable in that position. What you want to do here is really drive your weight down through the outside of your knee, feeling on the lateral hip and the vastus lateralis. Exhale on the way down, drive that knee into the ground, and then hold that position for 3 to 5 seconds, and then really focus on driving that knee into the ground. So you almost want, when you're coming back up out of that position, to feel like your knee is driving the movement. So this is helping to work your lateral hip in eccentric fashion, concentric fashion, and isometrically. So pushing down with that knee on the way down, pause, hold that in range position for 3 to 5 seconds, keeping that hip working hard, so pushing into that towel throughout, and then really keeping that knee almost glued to that yoga block or that towel all of the time. So you're going to feel this in the lateral hip. You may also feel it in the anterior aspect of the hip as well, as you're in this position for a period of time. Okay, the next movement we're going to look at that we're setting up here is just a breathing exercise. So what you're going to do to set up for this exercise, you're going to have a chair nearby. You're going to place your feet on that chair. Ideally your hips are flexed close to 90 degrees, knees close to 90 degrees. What you want to do is build some tension by pushing those heels down into the chair, feeling your hamstrings working. Keep posterior tilt as much as possible. Place one hand on your abdomen, one hand on your chest. Take some relaxed breaths here. Now for this breathing cycle, what you want to be working on is, as you're exhaling, that your rib cage is almost depressing. So what you want to happen here, as you're breathing in, you want your hand on your abdomen to rise, followed by the hand on your chest. Pause and then exhale for 4, 3, 2, 1. Pause, and then as you're inhaling, you want to feel like that breath is going as far as your abdomen muscles, so that hand is rising first. followed by your chest is rising second. So you're almost breathing in a wave pattern, and you're repeating this cyclical pattern of breathing in for 4 to 6 seconds, and then pausing for 1 to 2 seconds, and then breathing out, exhaling, letting your ribcage depress for 6 to 8 seconds. You can just repeat this cycle for 5 to 6 breaths, and then breathe normally for 1 to 2 minutes.